One of the major fears, I think, in plastic surgery is changing someone's identity. And I think that's something that we oftentimes see too often. We walk down the street and we see someone look like, oh my God, who's that person? In fact, my mother, when I told her I was going to go into the field of facial plastic surgery, she says, oh my goodness, I went down to the grocery store, I saw a lady that looks like this. Are you going to make people look like that? Is that what I paid for my son's education to do that kind of thing? And the answer is no, but I really want to talk to you about what identity is and what happens with identity. There's two types of identity. One identity is, okay, you know what, I've gotten older and now I'm going to get plastic surgery, and all of a sudden your brows are 14 times higher than they were, this cut, everything's eye back, the facelift looks weird, the mouth has been distorted, and that kind of identity change is what I'm not talking about, okay? But what I'm talking about, let's take that identity change and move it over for a second. Let's talk about a different identity change. How about the identity change just that comes with aging? Think about this. When I actually work with patients for rejuvenation, I take their old photos and go, oh, this is what you used to look like, my goodness. And the older they get, the more different they are from when they were in youth. So they bring in their photo at 20, or they bring in their photo at 30, and then maybe 50 or 60, and look nothing like that person that was there in youth. So remember that when I consider identity change for a moment, let's entertain the idea that it's nothing to do with plastic surgery for a moment, it has to do with aging. And the way to best encapsulate that, especially if you're older, especially maybe if you're 50 plus, and I say, what if you walked into a room with you yourself standing in front of you at 20? Would you recognize yourself? And the answer probably would be yeah, but it would actually take me a few double takes to say, oh, that's me, because I don't look like the same person I was. So the identity change that occurs is actually the identity change that occurs with aging, and the fact that you actually don't look like the same human being after many, many years. And not maybe after 5 or 10 years, but more and more time, but even after a period of 10 to 15 years, there's a slight alteration in your identity where you don't look quite like the same person you were. So the other thing that's really important is the way that I phrase it is that I actually restore identity. I bring someone back closer to an old photograph. Now remember, in my other videos I talk about that it doesn't have to be a 20-year-old photograph. A lot of people don't want to look 20, and sometimes at 20 there's a lot of baby fat, you may not want that. So I'm talking more about, let's find that time interval where you thought you looked good and let's get closer to that. What's really interesting though is that I don't get you exactly to 30, I don't get you exactly to 20 or exactly to 40, but I make you look a lot better and closer to that. And by approximating youth, I make you look so much better, but you don't look like a different person. I get you sort of halfway there and you look a lot better. And that's really important. Now what happens if you've had bad plastic surgery where your changes are dramatically different from where you were even a year before when you had the eyelid surgery done? Well, remember one simple thing is that my goal is to restore your identity, and actually the way I look at it, let's take a look at this. Let's say here's youth, here's aging, and here's weirdness, okay? If you're all the way over here, weirdness, I'm going to push you back through aging and push you back down into where you need to be so that you look better and youthful, and also you don't look weird. And that's really important. Now, not 100% all the time, but I can drive you in the right direction. Now, why is that? Why would my surgery be a bit different from what you've had? Well, let's explain it. Most people lift the brows up. I actually, in most cases, drop it. And that may sound scary to you until you sit down and talk to me and you begin to understand what that means, reframing it. A lot of people suck the bag out and pull this tight. I fill it back in. So, and a lot of people try to lift the jowl away. I try to fill the central chin and blend this area in. Now, all those things sound a bit weird and frightening to you until you sit down with me. But my goal is to have you understand that what I do is oftentimes just antithetical and 180 degrees opposite of traditional face work. So by thinking of it as already being 180 degrees the opposite, so that I move you the right direction. So sometimes when a lot of aggressive surgery is done and people are moved over to this weird zone, I push them back through the aging and then back into the more youthful state. So you understand that, just to re-encapsulate, I don't change identity, I restore identity, the identity of youth. And hopefully that was a good summary for you to understand identity.